Those of you who have been here with us, welcome back. For everyone new, welcome to your very first Lecturio event. I hope that it will live up to your expectations. Okay, without further ado, let's start. So we'll discuss the new Qbank experience to drive smarter remediation and exam readiness that we have at Lecturio. So before we start, I just wanted to introduce myself. I will be your host for the day. My name is Goran Stevanovski. I'm a medical doctor from Skopje, North Macedonia, where I currently am. And it's late afternoon here. And I've been a medical education consultant here at Lecturio for a while. So if you've been to these events, you probably know me. So we have Lecturio all across the globe. We've already kind of covered where everyone is from. So thank you so much. And before we start discussing the Qbank and before we start diving deeper into the topic today, I will just do a quick bird's eye view or review of who we are. Who are we here at Lecturio? So this is one of the most comprehensive digital medical education platforms on the planet. We have content coming from top professors from one of the best universities around the globe, and we have we have the entire medical and nursing curricula covered within the platform in all key learning formats. So the platform itself, if you haven't used it thus far, consists of high-end videos. We have plenty of those, and the number is continuously growing. So they're short, they're engaging, and they're in high quality. So if you haven't had a chance to see that, please do let us know, and we'll be more than happy to show it to you. We have clinical cases with text and video explanations. We have recall questions, something that we will talk a little bit more about today. And we have concept pages that are completely tied and related to the videos. Now we also have AI tools that you can use for yourselves and your institution so you can make learning for your students the best you possibly can. These concise videos are there on all key concepts. So all of these videos look the same. And, for the sake of concentration, they're between 3 and 9 minutes long. And they're all done in the same studio. So, there's no discrepancy between what they look like. There's linked recall questions for formative assessment, which again is very important to the topic we discussed today. There's 3D anatomy with pre-mapped views, something that I would have used as a student had I had it at the time. And then there's comprehensive coverage of clinical skills. So before your learners get to do these clinical skills in person, it is great for them to be able to see how that's done and increase safety around patients. And this goes for both medical and nursing, but we also have other advanced degrees like PA, DO. I already discussed the clinical cases with the real life clinical scenarios and the automated feedback you can get there. And there's learning paths that are pre-programmed within the platform that you can use to study for a standardized exam or just prepare for the exam at your institution. The concept pages are a very pragmatic part of the platform. They're kind of related and tied to each of the videos where they have these concepts presented for students to kind of go back and relearn and repeat and remember what they've done. And they have very nice images as well that can help students visualize. Now, there's two sides of precision health science teaching. Part is for student, the other part is for faculty, like yourselves. There are digital teaching assistants with faculty, and now they are also supported by AI. We even have an AI teaching assistant that can help you find PubMed papers in real time. And most of these AI loops are kind of closed within the platform, so that reduces hallucinations, but also fake information. For students, there's personalized smart tutor, and we will actually scratch the surface on that a little bit today, and you will be able to see it. Probably one of the most important parts when we talk about remediation and following your students and meeting them where they're at instead of meeting them halfway, it's the Life Faculty Dashboard. And this can really track what your students as groups or individuals showcase regarding competence, confidence, overconfidence, spaced repetition adherence, mastery levels, the most typical and common mistakes, or readiness assessment in general. And that readiness assessment is very important when your students are about to be evaluated. And this can give you different statistics for the assignments that you have given your students. So the platform also has the ability and the possibility for integrating flipped classroom within your teaching. So this faculty dashboard being live can really help you follow where your students are at. And it gives you aggregate data because then you will also be able to kind of follow your students, what they're doing, how you can best help them. But this can also showcase how changes in your teaching are also changing the behavior of your students, their knowledge, and their formative and summative assessments at the end. There's easy integration with your existing setup. So if you're someone that uses any form of LMS, Canvas or anything else, even if you use Proctorio for exams, this is very easily integratable. And then you can also tie this to Power BI or R or any other statistical analytics program that you have. Now, if you're interested to know more about the platform itself and the other products like Healer or Seam Tutor that we have, feel free to scan that QR code or just reach us on any platform where you can find us to actually see these features more and get more information about it. Okay, that was sort of the high yield overview of the platform and who we are at Lecturio. From this moment onwards, we are going to discuss Qbanks in assessment. Now, we'll look at the use of Qbanks in health professions education. And if you're someone that's been following the assessment side of medical education or health professions education at large, you know that especially for the standardized exams, the Qbanks have become a gold standard. And all of the students, 97.7%, according to some papers, are using Qbanks to prepare for USMLE or NCLEX or any of the other Pansy, any of the other standardized tests and exams anywhere else. But before we dive into Qbanks, let's just kind of do a high-level review of why assess. So assessment is the backbone of learning and clinical readiness. And to one extent, we have formative assessment, which is the feedback and assessment that your students get throughout the course at different stages. And then you have the summative assessment that gives your students the green light that they can continue and move on with the next part of their training. Both of these are very important to also let your students know how well prepared and how well adjusted they are with their baseline knowledge and can also show their aptitude within what part of medicine or health professions they're more privy to be doing in the future. So as the backbone of medical education, assessment in many ways has the capacity to shape learning, to evaluate competence, and to ensure clinical readiness for the best clinical practice that your students can have. Now, one of the mainstays to assessment today are the multiple choice questions. And we do have a webinar just talking about multiple choice questions at large and looking at the pros and cons. And trust me, there's a lot of cons in multiple choice questions usage simply because they don't always necessarily encompass the reasoning aspect of students, although that's changing and we have a way of changing this. However, they still have certain level of objectivity. They're very highly efficient and they're incredibly scalable. So in a time where we don't necessarily always have time as faculty to assess each of these students one by one, which is something that I think our ancestors had because they had less students and less materials to cover. Today, we do need to make this scalable and we need to make sure that everyone passes a certain level of assessment. So today, especially with the introduction of artificial intelligence, the creation and the review of multiple choice questions become faster, more accurate, and more accessible, improving both quality and reach. And we do have an AI question generator within Lecturio. If we have some time today, I might show it to you. If not, feel free to go on our website or our YouTube channel and you can find a plethora of different webinars that look at our AI tools, including the AI questions generator. Now, the role of multiple choice questions, as I said, is there because of this objectivity, efficiency, and reliability. And I only added this here so that you can see that there is a lot of scholarship practicing or a lot of scholarship proving this discussion. Now, MCQs continue to be a cornerstone of assessment in medical education. And when well designed, they do more than just crude recall or even recognition, but they do have the capacity, although we need to be more mindful to do that, to evaluate clinical reasoning, decision making, and ultimately the readiness for practice. Now, the Qbanks, and I would love to know if you're using Qbanks at your institutions, to what extent you're using Qbanks. So feel free to use the chat option for that to share any of your experiences. But the Qbanks mostly and mainly are based on multiple choice questions. my institution, where I went to medical school and then worked there for a while, had did have Qbanks, but a lot of those Qbanks were either open-ended questions or there were varying parts of different ways of assessment, although the majority even there were multiple choice questions. So that's why I wanted to share that. Now, I do have a question for you, and a poll should pop up on the screen. Which is, when does learning actually happen in a Qbank? So you could answer this in the chat if you want to say more than what is given as an option. If not, feel free to just take the poll. So when does learning actually happen? And the choice answers are when students get the question right, when they read the explanation of the question, when they struggle to retrieve the answer, and when they review later. So when a student takes a multiple choice question and when they answer it, afterwards, we need to make sure that they understood and they learned, and that the concept that the question was testing is going to move forward with the students. Now, I see there's answers trickling in. I want to thank you all for participating and for answering this question. And I see that there's one of all the choice responses have certain answers to them. So thank you very much for that. And I would say at the moment, the majority of people say that learning actually happen when students read the explanation for the answer. And I would just say learning happens all across, right? For all four of these, there is certain truth to all of them. There is one best answer, sort of, and this is how MCQs and Qbanks actually work, finding the best answer. And I would say the best answer here is when students struggle to retrieve the answer. And this is that way because, and we do have webinars on the role of memory in learning, but when students struggle to retrieve the answer, these engrams in the brain are being created more efficiently because that's the moment when students associate their struggle to get the right answer to this question with remembering it. And that doesn't mean that the questions need to be very complex, because too complex questions can make students be detached from that learning. Too easy questions are highly mechanical, and students don't necessarily spend a lot of time thinking about them, and they just forget that they took these questions. And when they review the question later, this is called spaced repetition or spaced retrieval. They do tend to create more efficient engrams long term. But what the science says about this is that when students kind of tend to struggle a little bit, when they need to start thinking about how to answer this question, they generally remember it or learn it most efficiently. So when they get it right, they do learn a lot, obviously. But when they get the question right, they tend to kind of feel more confident about it and not think about it, and there's higher chance they'll forget it. When they read the explanation, somebody walk them through, and that's also very important. But the struggle aspect within it, and this struggle doesn't need to be Sisyphus struggle, right? It can just be them stopping to think more a little bit about the question. That's essentially when they're trying to retrieve different information they learned from the course. Okay, thank you for taking that poll and for participating. So before we move into the platform, I just wanted to talk a little bit about the testing effect, which is the knowledge and the scholarship that we have that the testing effect, meaning students taking questions, even in the studying, in the learning process, not just at the end, does help with information retention. And when they use Qbank, there's 41% better information retention through this testing effect. And obviously, there's different studies giving you different percentages. This was a good study with a good methodology that talks about this. And although 41% might not look like a lot, it's almost half of better information retention through this testing effect. Now, Qbanks don't just test or assess learning. The important part is that they also create it. What we can see throughout the medical education science or the learning science is that this testing effect also allows for learning to happen during retrieval. I've personally had lots of students in the past that would say that they liked the exam because they had the ability to learn new information during the exam. I don't know if that's necessarily a good thing, but it's really good that they actually managed to learn something new. And then feedback strengthens and corrects understanding throughout this process, and that's why learning happens. Now, there's the high impact and the low impact use of Qbanks. When students tend to commit to an answer, especially in the practice phase, before they go and read the explanation, there's a higher impact learning. Whenever there is effortful retrieval of the information, that struggle that I mentioned in the previous question on the previous 2 slides ago, not just crude recognition, because in multiple choice questions, sometimes you might recognize the best answer instead of effortfully retrieve it, or active review of explanation instead of just passively reading why the right answer is the right answer and why the wrong answers are the wrong answers, all lead to high impact use of Qbanks. The low impact use happens when students just skim through explanations, which it happens when they don't have a lot of time. When they have that, I knew that thinking. I remember with my colleagues when I was a student, we'd have that. You get the question wrong, but afterwards you say, well, I knew that. That makes sense. And the no structured review, beyond just kind of clicking through this Qbanks and the questions, have the low impact use. So this isn't just about us using Qbanks or our learners using Qbanks. It's about using them in a smart way. So the gap here isn't just access to questions. The gap actually happens um, when students just kind of click through those questions and they kind of try to get through the Qbank and say, I use this to prepare for my USMLE Step 2 CK without them stopping to kind of understand the concepts and take their time with it. Now, the gap of understanding on the faculty side, though, sometimes happens because as educators, we tend to lack clear insight into specific performance gap that students take or have. So if you just kind of assess your students, we say by the end we have formative or summative assessment. This is your score. You move on because you did well. There still might be some performance gaps or needs for remediation for certain parts of the learning of that course or learning of that system. Now, we lack this clear insight into specific performance gaps because there's simply not enough time for us to engage with the students on that level because we tend to have a lot of students and we tend to have a lot of work outside of teaching and assessing. Students struggle to identify high priority focus areas without us being able to understand that they struggle to identify high priority focus areas. And the review processes are often inconsistent and unfocused, again, because of lack of time. So students do generate a lot of data when using Qbanks and when they do practice sessions, yet the path to improvement remains obscured by a lack of clarity on our side. So at the end, we're not just always short on questions, but we're short on actionable insight, which is why we wanted to showcase the Qbank today. So to bridge the gap, we need to be able to identify knowledge gaps with precision. We need to guide targeted remediation for high impact results, and we need to be able to track students' progress over time without any struggles. Now, you probably ask yourselves, especially if you've known Lecturio for a while, what's so new about the Qbanks and why are we talking about them today? So even though the Qbanks have been a quintessential part of the Lecturio ecosystem from the outset, from the beginning of the platform's existence, even though they've been the mainstay for a long time, we have tried to use learning science and all of these insights that we're talking about to really take the Qbank from just making it a learning tool, from just an assessment tool into making it a learning tool where students can have a really good experience to use this Qbank. And in the process, we wanted to show you both the Qbank and what it consists of, what these questions look like, but also some of the novelties that you can use as faculty members. So now if you'll have me, I will stop sharing for a second. And what I'm going to do is I'm going to show you the platform and I'm going to show you these Qbanks that I'm talking about. And if you have any questions or thoughts or comments so far, please do let us know in the comments here. Let me check. There doesn't seem to be anything new in the chat. Okay, so let's start with sharing the platform. I hope everybody is ready. Now, if someone can just let me know if you're able to see it. It does say that I'm screen sharing, so I assume it's good. Thank you. Okay, so this is what the platform looks like. I think I did cover some of this in the beginning. So we will directly go into the question bank here. And we do have a lot of those. We have a lot of questions as well. And the view that we see right now is what your students are seeing or what your learners are seeing. And you'll be able to see this as faculty as well. But now we'll start with the question bank from the learner's perspective. Now, when you go here, there's again a lot of Qbanks that you can select from. We have the AI Qbank because I already mentioned the AI question generator that we have. So all of the AI created questions tend to go into one bank of like just AI questions. And we do have clinical, nurse practitioner, the physician associate, preclinical in your institution's questions. So if you have Lecturio as an institution, you're also able to take your existing Qbanks or any Qbanks that you create throughout your work and place them here into your institution's questions. Now, there's less Qbanks on this side, on the learner side, because some are used for assessment or some are used for testing or exams. So this is what, again, your learners are seeing. Let's start with clinical, with USMLE step two to begin with. And there's learning paths here. I will click that for a second just to kind of see what's already pre-programmed into the platform. So these are learning paths where you could study, add to your study planner. And while you can use this to study, you can also use this to make sure that you self-assess and that you have practice exams along the way. And we're always adding new learning paths, so there's already so many, but we are able to add more if your institution so needs it. Now we're going to create a custom test now because I want you to be able to see what this looks like. There's a lot of step two non-answered questions here. You can choose the difficulty level. Let's stray away from the hard questions for now. You could look at subject. Let's go with internal medicine. That also tends to have the most questions here. And these are all, again, practice questions. System, let's say endocrine, potentially rheumatology. Who doesn't like rheumatology, right? So you could take this test as a learner in study mode or exam mode. The study mode means that you can utilize the AI functions of giving you hints or the Socratic tutor that we'll talk about in a minute. Or the exam mode means that in this case, you're self-assessing because I look at this as a learner. And the number of questions is limited to 20. You could add more or less, but 20 is sort of the optimal number of questions. And we're starting the test. So because we took USMLE step two, these questions are clinical, right? It's CK or clinical knowledge. And that means that every question comes with a patient vignette, very similar to the USMLE step two CK. Now, looking at this, we could read through the case, but I just wanted to show you a couple of the possibilities that we have here. So each of these patient cases comes with lab values that are specific to that patient case. So if you need more information, you can go through here and you can look at the reference ranges because, as you can tell, or maybe this case doesn't have it. More often than not, cases tend to have certain lab values. And if you're uncertain if they're within normal ranges, the references are here, and you could look at cerebrospinal fluid, blood, urine, and BMI. Then you can take notes, and these notes are kind of private to your students. Calculator for all those pesky statistic questions. And within the settings, you could reverse the color. So we can make this dark mode. My entire laptop is dark mode, so I usually use it that way. And you can resize the text of this for people that can't see very well. I'm going to bring it like that so that you can see well. Now, when you look at the question and when you read the question here, um, you could dive straight into answering, especially if you know what the answer is, what the right answer is. But you could also consult AI Tutor. And we are in learning mode, so that's why this is here. As you can see, we have two types of AI. So you could chat with AI Tutor that uses the Socratic tutoring method, which means it's actively asking you questions about your reasoning so that, it deploys metacognition and you can learn about why you think that's the case. You could get AI hints. It's really important to confirm that you understand this feature uses AI. And let's see the AI tutor or the Socratic reasoning one in this case. So you're the one starting after you're asked the question. So I will work how to solve this. How would you like to proceed? Now, I didn't read this question because I've been talking nonstop. But let's say that you can say something along the lines of, I believe the answer is D for some reason. So it's an interesting choice, right? It doesn't agree or disagree with you. It's just kind of probing and asking you questions. So this would be as if you have a friend or a trusted mentor next to you and you're able to kind of reason with them. So you can explain what led you to select it. I kind of wish I saw the question beforehand. So if you've read it, feel free to use the chat option and say why we think it's D, even though I don't know if it's D. Now, in this case, I can say because the patient has been, and this makes no sense, taking paroxetine. Let's see what it says, because this is, live and it is AI. So thank you for sharing your reasoning. Main symptoms: chronic widespread pain, sleep issues, multiple tender points. How do these findings relate to the typical conditions treated with allopurinol? So you could say they don't, right? They do not. However, they do. Um, let's say they do relate to high dose prednisone, for example. Good observation, right? So you can continue with this, and then in the end, you can just say, "Let's do that. Let's submit answer to save time." And when you do that, in this case, it is incorrect, as you can see. But if it is correct, it does say that we've used AI for the reasoning aspect, and then it does give you all of the explanation, what this means and why. You see, you even have an image here. It gives you the differential diagnosis. So, as I said, it doesn't just test your ability to click through and find the best answer, but it does allow you to sit down and reason with this. And what's really great is you have the related videos that teach about fibromyalgia. See, I didn't read this and never even saw that it's that. And you also have book references as to where you can find this down to the page. Now, you can add feedback to this, but let's for a second go to the next question because I want to be able to show you the other AI function. So we have a different case here, and now let's see the AI hints, right? So apart from the Socratic tutor that helps you reason, this gives us a hint. So it says the next step would be to investigate the cause of low cortisol levels. With the hint I've given you, what option do you think is the correct one? And you can say, I don't know, this. And then it continues to go back and forth as long as you want. And if you're not right, it will ask you again and again. And then you can just, I don't know, choose one and submit answer. Wow, I shouldn't play the lottery today. Um, and you get the same answer in the end. So this is what your learner is really seeing, and there is a lot happening in the background of this as well, because then you get the statistics of how long this took, right? You can pause this if you're not next to the computer or your phone. So this does track a lot of information in the back. I'm going to end the test for a second. Um, but I hope that does give you sort of an idea of what's happening. And again, this is in learning mode and it's not in testing mode. Now, this is what your students are seeing, and we could go through multiple questions, right? We can do the nursing, and just to kind of show you what this looks like. You have the subject here, right? Let's say mental health, right? Client needs, health promotion, psychosocial. Let's do that. Body system. In this case, it's only these two related, and these questions exist, and you can do study and exam mode. There's two questions in the practice mode because I don't have access to all of it at the moment, but this looks very, very similar, but yet it does look a little bit different because we do like to be able to showcase that you're in a different sort of side of the platform. Okay, let's just do that. Oh, there you go. Okay, let me end test for a second because I would like to be able to show you what you can see as educators, because as you said, most of you are faculty. So now we go into the administrative aspect of things. When you click administration, you get the view from the faculty side, and you see this is already very different. You have a lot of AI tools here that I mentioned. There's the question bank where you can create a Qbank test from scratch, but you also see all of these statistics. Now we could go in Qbank management as well, where you can decide which of these Qbanks that are available on the platform are visible by your students, by your learners. learners. But here we look at Qbank performance, and this is the part that's new. You can kind of see that my learners, which is essentially my colleagues, are not doing great. But you can look at group or user. So first year students, DO, test groups, anything you have, or you could look at individual user or individual student and how well they're doing on this Qbank. So if you want to say, I want to see my group of second year medical students or third year medical students and how well they're preparing for the board's exam and are they practicing their Qbanks, you can really go here and select the group or user and really look at the date range, all the questions they've taken, the Qbanks they were a part of. We have this auto translation of questions, so you can see some of the questions in different languages as well, depending on what your students are practicing. So we see all users. Let's look at all Qbanks. And let's look at, yeah, this should be enough. So we see how many of the questions are correct. This is essentially what I took earlier. And you can look at performance by subjects, and you can get all the statistics here. You can look at the performance by systems, right? Microbiology, molecular and cell biology. And then you could look at users, a particular user. So we have some users. I'm going to get my colleague Adonis in all the Qbanks, or I have to be more specific. Let's take the step 2 for a second, just to see the results of what this looks like for individual users. So there it is. And when we open this, for this particular user, again, it could be a group. You see what is the score, what is the test, what is the date they took this, whether it was timed or untimed, whether they used Tutor, how many questions they took, what are the results of those questions. So you really get a lot of insight, a lot of intimate insight into what your students, what your learners are doing when they get in touch with this platform. Okay. So you can go into the Insights dashboard. Give me a second. And in here, you can really deep dive into the statistics, right? So you have the overview, but you can look at the performance by course, performance by user, performance by Qbank that you've given them, and by AACN Essentials. So again, we have user, we have group, and look at the wonderful data, this very rich data that you can get within the last 12 months, 24 months, or just different range. So again, these are statistics that are kind of unique because when you're just teaching medicine or teaching any class or any subject, you typically don't tend to follow your students to this level. And you can look again at all users and you can look at anything you want. Library curriculum, you could look at separate topics, say behavioral health, subtopics, different Qbanks that you have, that your institution has. Let's look at step 1. Oh, apologies for that. It is using a lot of computational power to get that done. But I think you're getting the gist of it. And then you can use this for remediation as well. So if you see that you have struggling students, you are able to get to exam readiness. So if you are using this for a particular group that's studying for the step 2 or studying for the step 1 or studying for the NCLEX, you are able to see to what extent your learners are ready and who is potentially not ready to do this. So before we end the webinar today, I would quickly like to show you the AI tools. So we do have a few, and I already mentioned the question generator. Now, again, there's separate webinars that look at question generators, MCQs, and everything. So I'll just do a flyover because we do have a little bit of time that I would like to use. But if you'd like to learn more about this, please go and check our resources. Or if you want a more specific demo, or if you would like for us to give you an opportunity for you to try this yourselves, get in touch with us and we can get it done. So in here we have, again, different types of exam types. We kind of started with a step 1, so maybe let's do that. We have the systems. Let's do immune system, for example. And you could do more. So it could be immune system and endocrine system, and we could look at autoimmune diseases. The discipline could be, again, internal to continue it. We have nature of questions. Let's do diagnosis and management. So you can take more. And you do keywords here, just like you do with any other AI. So in this case, let's look at autoimmune diseases of the uh, thyroid. There you go. So you could do multiple questions. You could upload a file for keywords. You could also upload anything that you use in your institution to assess properly. You can use a language. So in here, you can create this in different languages because AI knows them. And let's do moderate in this case. We want this, and you want to confirm you understand this feature uses AI so that you don't give any personal identifiable data. This is sort of the system prompt that you can change if you want to, or you don't have to. And then you're essentially generating questions by the end of it. The beauty of this is, though, you're always more than capable to be changing these questions and can review them. So this question generator won't write questions and without asking you send them to your learners or to your institution. This is autoimmune disease, young female patient. So we have all this, it's Hashimoto's, very surprising, and it then gives you the explanation of that answer. We click next, we could publish this within any of the Qbanks that we have existing, or we could just delete it like I will do now. Before we finish, and as promised, I will leave you a little bit of time and we'll finish a little bit earlier. I wanted to share a few more things. So if you want to learn more about our features and our platform, please scan this QR code and get in touch with us. I hope that there was something new that you saw today, or that you saw something that you like, or something that's specific to your teaching and your context. We'll be more than happy to do a personalized demo for your institution. There's another poll question before we leave today, before we close, whether you want a personalized demo for your institution or not. You could request a demo also at institutions@lecturio.com or visit our website. And before we leave, I just want to thank you all for carving time out of your day to be here with us to hear more about Qbanks and more about assessment. I hope to see you very soon to one of our webinars or online workshops, or even these global demos that we're doing. Please share this with any of your colleagues or your students, your learners, if you think this would be specific to them. And I want to thank you all for being here. With that, I conclude this global demo. Thank you very much.